Okay, I'm going to explain to you the difference between a phonological disorder and an articulation disorder. And with a phonological disorder, just to explain the disorder, so we have a phonological system, and this system governs the way sounds are put into words. And someone with a phonological disorder is going to have difficulty acquiring that phonological system. And those errors or processes that we see are consistent errors. We also see mispronouncing of some words. We also see prosody and vowels are intact. And so those are the characteristics. And in order to screen for a phonological disorder, we want to make sure we have a thorough case history, we have a hearing screening, we can do an oral exam, and make sure that it's phonemic level and not the production of the sounds. So we want to look for those patterns in their language. And to assess this, we are going to give a Goldman-Fristow and then do the Conn-Lewis, or there's also the CAP, which is the articulation and phonological test. And after we get results for that, those results can drive our treatment to see what processes they are using in their speech. And as far as treatment, for a phonological disorder, we have focusing on the phonological processes, or we have distinctive features, so looking at place, manner, voicing. And before I talk about treatment, I do want to talk about goals and how we would write goals for this population, and also with articulation disorders. So we have vertical goal writing, kind of like our attack strategy, so we can do one or two targets and for a certain amount of time, and then once the child has reached mastery of those targets, usually in the conversation level, then you can move on to new targets. And the vertical is really for those students who only have a few issues and difficulties. And then there's also the horizontal goal attack strategy. And the horizontal is a larger number of targets and not as intense, not the drilling. This is just going to look at a larger number of targets and really looks at hoping for generalization. So after you have your goals, then you'll start your therapy, and your goals will obviously drive your therapy. And you can look at the contrast approaches, you can look at the cyclical approach, which selects a target, and then once it's mastered, it comes back in a cycle. And so it's that cyclical approach where you kind of target a specific sound for a week, and then you introduce another sound, but you cycle the first sounds back. And so it's kind of this cycle approach, and there is research on the effectiveness of that approach. So that's phonological disorder, and on the other hand, there's articulation disorder. I don't know why my voice is doing this. So with an articulation disorder, the child is having problems producing the sounds. And with articulation disorders, you're going to, some of the characteristics are going to be those errors for substitutions, omissions, distortions, and maybe additions to the words. So I have the definition, the characteristics. Now, to screen for articulation disorder, you're going to want to do a hearing screening, a case history, and also an oral mechanism. And in order to assess for an articulation disorder, you're going to give the Goldman-Fristow. You can give the Goldman-Fristow to see where the errors are and what kinds of errors that you're seeing. And so to treat an articulation disorder, and the goal writing is the same for the phonological disorder, but to treat an articulation disorder, we're going to want to see how they respond to prompt or giving phonetic cueing, phonetic placement, and focusing on those errors that they are producing and seeing if you can use a mirror to help them see where they are making mistakes. And articulation is all about the difficulty of producing the sounds. So you do want to do an oral mechanism and see maybe they aren't able to protrude their tongue, and it is important to look at the frenulum, making sure that that's not too short or causing those distortions. So yeah, there's a lot of great activities as far as articulation. And in terms of goals for articulation, you can use the developmental approach or going the non-developmental approach. So developmental will just look at what sounds they're missing as far as when they should be produced. So depending on the age of the child is when it should be produced. And